everyone. Welcome to our Influence Stories. Today, I'm very excited to have Ana Maria Patino Fernandez, who is a licensed psychologist, to talk about some things that I believe are in everybody's mind, especially those of us that are parents, as we are going through the COVID pandemic. And there are many things that I think affect parents. We think about our children's well-being and how they could be affected by the COVID pandemic now and what this could do to them in the future, as not only their mental health, but also their schoolwork, their friendships, and we're all stuck in the house for the most part. We were going on almost 3 months, I think, or 2.5 months for some families, and here in South Florida, and much more for families, for example, in Europe and in New York. So I think that this is something that a lot of parents are thinking about. The school year technically ends today here in Miami-Dade County, or yesterday, the 3rd. There are a lot of graduations going on everywhere. Everyone's driving by. So I want to thank so much Ana Maria for joining us today to talk a little bit about how this whole situation affects kids and young adults. Thank you so much for joining us.
Thank you for having me.
Well, tell me a little bit about your practice, and tell me a little bit about what you do, so some of our people that are watching us can get to know you a little bit better.
Sure. I specialize in working with children and adolescents and their families. Most of the work that I do centers really on the treatment part of things. So I work with children and adolescents who are anxious, who are depressed. Sometimes they have, difficulties at home or difficulties at school with, peer relationships or just the relationships with the families at home. So that's one aspect of my practice. The other piece of my practice is I work with children and teenagers, again, mostly, sometimes young adults, doing evaluations. So those can range from developmental evaluations in the really young ones, if there's a suspicion of autism or a developmental delay. And then I also work with children and adolescents throughout elementary, middle, and high school, and sometimes college, if they're struggling with difficulties learning, difficulties with attention and comprehension. So they're the two main aspects of it.
How has your practice changed because of COVID? How has are you a lone practitioner, so to speak? You're on your own, or do you work in a hospital?
No. So, well, actually, I wear a third hat, and I do pediatric psychology. So I do work in a hospital on an on-call basis for children who are admitted to Baptist Children's Hospital. But that's a sort of a small aspect of my practice. But I do enjoy the medical work quite a bit. But in that regard, my practice has changed. Almost everything has moved to telehealth, including working with the children in the hospital. And so right now, or since March, really, since the beginning of March, my clients who wanted to move to a telehealth platform, we did that so that we meet this way through video weekly, and we continue to work on what we have been working before. My assessment practice, I did suspend until this past week, actually, because of the nature of the work that I do and the clients and the patients that I had in waiting, very young kids or children with attention difficulties or behavioral difficulties, doing the evaluation remotely through a video conference would have been extremely challenging for the families. And so we put those on hold, and I'm starting back with them this week, obviously with certain precautions and sanitary measures.
Oh, good. So it has been, I mean, you're a small business, right? So it has been an effect for you, some changes that you've had to do. I think a lot of small businesses, Influence Communications works with all sorts of organizations, and we've seen a lot of changes for small businesses, and some of the changes I've had to make, but they change but they're able to thrive and they're able to continue. I think we're facing, I mean, maybe, I don't know if you agree, that we're probably going to face this for at least a few more months, if not another year, of having to adapt to this new reality.
Absolutely.
So I think that it's very smart to make all these changes. To go to telehealth is one of the most important things that I think medicine has done. So now you focus on children and young adults. Now, tell us a little bit about what you're seeing as you continue your practice. What are some of the concerns that some of the kids and the young adults have as we face this pandemic?
So I think the biggest concern that children have, and their families too, is returning to school. So when when we first went into quarantine, kids and parents were worried about when we might return. And I think it's the uncertainty that really has people, somewhat stressed and overwhelmed. And the not knowing oftentimes can exacerbate stress and anxiety in children. So I think for kids, they're worried now whether they're going to return in the fall, if they return in the fall, what that will look like. A lot of them also worry about their own health and their family's health. Many of my clients, worry about their grandparents. If they will get sick and what will happen if they will get sick. There's also a lot of information, especially for younger kids, that has to be digested and presented to them in an appropriate way because they just have a fear or a worry about sort of health in general, and what might happen or what will happen. And I would say the other thing that lots of kids are worried about, especially now as things start to open up, is how do they navigate? How do they get together in a safe way or not get together in a safe way? Right. If they're not getting together, what are they missing out on? Are their friends interacting and they aren't interacting? And so there's just a lot, especially for the, tweens and certainly for the teenagers, that's really on their mind, is really being with their friends again. And how do you do that in a safe way?
Right. In my situation, I have a 3-year-old and a 5-year-old. So I have a very different situation to parents. I have teenagers. I know your children are a little older. So my kids, they have a different view, but my concern is I can't let them be with their friends because they're going to be like hugging and sharing food, and it's impossible. So there's that concern that they're not spending any time with kids their age. I mean, at least they have each other. In my case, I'm very grateful for that. They do get along. They fight, of course, but they get along. But there's this issue with the teenagers that also feel like they're missing out on proms. I mean, this is graduation season. Some of them are graduating high school, and they're going to miss out on their graduation, which is a big deal. They're missing out on proms, like I said, and all of the fun and memories that goes with that. So I think that, I don't know if you've seen some of that concern as we approach the graduation season.
Yes. A lot of them have really expressed, being sad and upset at not being able to say goodbye to their friends, to not have these activities that really have become a rite of passage for 8th graders, for 12th graders, and really not having that. I think some schools have postponed graduations, and they've talked about doing them sometime later in the summer. But certainly a lot of the fun activities, the bonding time with their friends before leaving, it was something they missed.
That's right. I mean, I can't imagine what it would have been like if I had to have missed my high school graduation, my college graduation. And what are some of the things that you have seen that are maybe on parents' minds that are really getting to them?
Yeah. The parents are also very worried about their family's health and well-being, not just physical health, but also emotional health. No one really knows what long-term effect the social distancing and the stress of a pandemic is going to have on young children. So many parents worry about short-term, long-term ramifications of the pandemic on their children. Certainly kids who already have mental health difficulties, so kids who are already anxious and depressed before the pandemic are suffering more.
Of course.
So a lot of their difficulties have been exponentially increased. And so parents who have children with mental health difficulties are very worried about them. They're also worried about staying healthy long term. And I think just worried about the future, their financial future, the world economy. They're worried about their family and friends. You know, we don't know how long, like you were saying, months, a year and a half.
Yeah.
I think,
and like you said before, we don't know what school will look like when we return, if we return. I mean, I don't think at this point, I think it's fair to say that not even the school board knows what anywhere in any place knows what it's going to look like. It's just this new reality of not knowing what's going on. And you mentioned something very interesting, which is, you know, how this is affecting those of us who perhaps already have some sort of a mental health problem, who are excessively anxious, or you know, there is just, I imagine, a lot of things that could happen to adults and to kids. So tell us a little bit about some of the tips that you would give parents to deal with perhaps children that have excessive anxiety in these situations. I mean, I have heard from parents that some of their kids are acting up, and they've never acted up before, that they're having trouble sleeping. Some of these things are starting to come up now. So what are some of the tips that you could share with us parents about how to handle this situation?
Okay. So those are really good signs to look for in a child. You know, if their sleep is disrupted, if they're not behaving the way they normally do, if there's an increase in temper tantrums or irritability, those are all signs that your child is experiencing, you know, some sort of unrest. One of the main ways that, and I think across all platforms, I've heard this, and I think it just stands the test of time, is one of the main ways to keep our children feeling safe and secure is having schedules and routines. And obviously that's difficult in a time like this when so many things have been disrupted. Finding that schedule, even if it's a wake time and eating times and a sleep time, I mean, that in and of itself creates a really good framework, because what happens is that children feel safer, they feel more secure when they know what to expect. So if there is a routine and there's a schedule, then they know what to expect. So that would be probably my main tip. There are lots of things though. I mean, affection goes a really long way with kids. You know, sometimes when we as parents are frazzled or stressed, we overlook some of the little things, a hug, you know, a tap on the shoulder, a kiss on the head, like all of these things help children feel secure. They take their cues from us.
Yeah.
And so, you know, taking care of ourselves too as parents is also really important for kids. Talking to them in a way that they understand, talking to them about what's happening either with our work, with the world, the economy, the health of the country, of the world, all of these things, again, in an age-appropriate way, and little pieces, especially for the younger ones, so that they can handle the information. But letting them know that there is something going on, but we as parents are taking care of them and helping them to stay safe.
It's interesting that you would say, give them information, but tidbits, because at the beginning of this thing, it's kind of like when you're waiting for a hurricane to hit, like you always have the Weather Channel on. So we had CNN on all the time, or MSNBC, or so always the news. And my 5-year-old there was a point where she said, "Turn this off, Mom. I don't want to hear about the coronavirus anymore." And it hit me. This is all these kids are listening to all day. We're stuck at home. It was at the beginning, so I had no structure. Everything was a mess. I didn't know what I was doing. And all I had on all day long was the news. And I just shut them out. Right. And I think it made a huge difference. They were very stressed at the beginning. And just by shutting out, letting them know that this is happening. And, we actually drew a coronavirus on a piece of paper, and they wash their hands and they're learning to do all that. But just by us calming down a little bit, not listening to the news 24/7, was very effective at transmitting a little bit of calm to the kids and their routines. The minute that I implemented a routine, like you said, it's very difficult. Parents are working from home, and it's very difficult to kind of keep it all together. But some semblance of a routine, I think, has been very helpful for us. So that's definitely something that could be something you could put in place and maybe help yourself and help the kids. Yeah. So, Doctor, I would like to know where, if somebody wants to talk to you, how do they reach you? Or if somebody has a question, I know you're on social media, or maybe share an email address with us so that some of our listeners here could speak to you or ask you questions, because this is, I think, something that's very important. I mean, I've always thought that child psychology and young adult psychology is very important, but I think at a time like this, it's even more relevant. And I know that you're going to be writing something that's going to come out in community newspapers. We're all very excited to read, so we'll be able to follow you there. But where can people reach you?
So a number of ways. I do have a website. It's Patino Pediatric Psychology. So they can reach me there, and through there they can find my office number and also my email.
Great. And so just so you know, we're going to put that in our when this is published, but right now we're live. So we're going to put this all in the information. Of course, everybody can always contact us, and we'll be happy to share your information. Now, if you had to tell a parent right now, somebody that has a kid that is misbehaving a lot, but doesn't usually, what is the one thing they should do first? Like, how do they handle a situation if their kid is being like very aggressive, maybe towards a sibling, or just throwing these tantrums where they're just completely, something that's completely out of the blue, but that is out of character for a child?
So it depends on the age of the child, but what I would say probably regardless is ask the child what's going on. Mm-hmm. What's going on, right? So you assume that there is something the matter, which I think is important. Kids appreciate it just like we do when our feelings are validated. Mm-hmm. And if the child is unable to verbalize, again, either because they don't have a lot of feeling words, or maybe they just don't have a lot of vocabulary or language yet because they're younger, it's okay to guess, to say, it looks to me like you're mad. And then the child will say, no, I'm not mad, or yes, I'm really mad about X, Y, and Z. So I think really helping kids label their feelings and talk about them and giving them that space to talk about it. I think a lot of times when kids misbehave, we jump in to correct them, right? Right. We don't do that. Don't touch that. Don't jump on the couch. Sit down. And sometimes, obviously, in times of stress, we need to ask them, what's going on for them? What are they feeling inside, so that then we can address it.
Yes. So that is something that I think a lot of parents, we don't do properly, is take into account that not just say, you're misbehaving, go to timeout. There's something happening there. And because we're also so frazzled and so taken aback by perhaps some like misbehavior that we're not used to. So take them into account, like you said, like you would like somebody to do to you. So that's always great. So I really appreciate your time. Thank you so much for joining us, and I think we'll probably have to revisit this in a couple of months or earlier, because I think, like I said before, there's a lot of uncertainty in the air, and I think that also affects how we as adults, feel, and how our kids definitely feel. Now, what would you say to parents that are extremely worried about what this will do to their kids, education-wise and mentally? Like, I talk to a lot of my friends, and they're worried that this is actually going to affect their kids psychologically for the long term. What are your thoughts on that?
So most children are resilient. Most of us will come out on the other side fine. So I think, obviously it's something that we worry about because we don't know. But I think we also need to remind ourselves that historically speaking, but also when you look at trauma literature, most people fare well. Again, those that will probably be most affected, unfortunately, are the ones who already had mental health difficulties. And so really those are the ones that we need to keep an eye on and make sure that they are continuing to get the intervention either that they were getting before, or if they weren't getting any intervention before, really amp that up so that they can get the services that they need. And parents, they obviously need to, they're sort of the gatekeepers. They need to also keep an eye on their children to make sure that they are faring well and that they are adjusting and coping with all of the changes.
That's right. Well, I really appreciate it. And, I just want to let everyone know that telehealth is available, and there's absolutely, there's a lot of shame, unnecessary shame around, these mental health issues, and that's completely unnecessary. And now it can't even, the comfort of your own home, there is no excuse. So I think that, I really appreciate your time. And, I hope that this little talk helped some parents and people that are feeling a little bit anxious about what's going on. If nothing else, to let them know that they're not alone, that everyone's feeling the same way. Well, thank you so much. Thank you so much, Dr. Patino Fernandez, for joining us. And thank you everyone that's joining us today and that will be watching this video later. Thank you all for joining us and Influence Stories. And be good and stay safe and healthy. Thank you, Doctor.
Thank you.